Ladies and gentlemen, today I'm speaking about hypertension in pregnancy. And your question now, the relation of hypertension to fast, the holy moon of Ramadan or not. Let us start by the definition of hypertension in pregnancy. There are 4 categories for hypertension in pregnancy. Chronic hypertension, what I mean by chronic hypertension, that you know about yourself, that you are hypertensive lady with high blood pressure before getting pregnant, and you are already on treatment. Second category, pre-eclamptic toxemia, which is developing high blood pressure after 20 weeks of pregnancy. Third one is chronic hypertension superimposed by pre-eclamptic toxemia. And the fourth one is essential hypertension, or sometimes we'll call it transient hypertension. What is the definition of chronic hypertension? Chronic hypertension means that your blood pressure is high and you may develop the hypertension during pregnancy, but on the first 20 weeks to say that it is chronic hypertension, not after that. Chronic hypertension, you should know about the cause. Forget about coming to me as a doctor and to check the blood pressure and to find that your blood pressure is high and take that type of medicine or that type of medicine, and that is will control your blood pressure without knowing the cause. That's useless. We should know the cause first, then to treat the cause, because this will interfere with our management during Ramadan. Causes of hypertension, either it is a renal factor or in some other factors, which I'm going to say it now, which we can discover it or we can diagnose it by blood test like urea, electrolyte, serum creatinine, or creatinine clearance test. That is a blood factor. Ultrasound scan for the kidney, because sometimes like polycystic kidney, congenital abnormalities in the kidney may cause high blood pressure. Doppler, which sometimes the renal artery stenosis, I mean the blood supply which goes to the kidney, there is a stenosis in the artery which may cause hypertension again. Or maybe the other common factor like atherosclerotic, like when we check about that by serum cholesterol and the triglycerides and so on. Situation like that, we have to treat the cause before we start the treatment. And treating the cause is quite easy. Let us go to the second type or second category of hypertension in pregnancy, pre-eclamptic toxemia. You are normotensive, your blood pressure is normal, but you started to develop or you started to have high blood pressure after 20 weeks of pregnancy. I mean, high blood pressure means blood pressure going above 140/90 with edema and more or less proteinuria, I mean protein in the urine. That's quite dangerous for the baby and even for yourself as a patient. For the baby, it may cause intrauterine growth retardation. What I mean by this means the blood supply to the baby is much less than it should be, and it may cause a stillbirth, which means that the baby may die inside the uterus. Or you may have a premature labor, or I mean premature labor, you deliver before time and the baby has to go to the special care baby unit. Or it may cause abruptio placenta, separation of the placenta and the bleeding, and you should have quick, very emergency cesarean section to save the life of the mother and the baby at the same time. That's what we call it pre-eclamptic toxemia. And we say it in Arabic, tasammum haml. Okay? Situation like that, we should take it seriously. And we should define, we shouldn't ignore it. This means that regular antenatal care is essential because nobody knows who is going to develop pre-eclamptic toxemia and who is not going to develop it. It's going to be discovered during the routine antenatal care. What do you mean? If you start to have headache or visual trouble or epigastric pain, please don't ignore it. Check your blood pressure quickly. And we have to do the baseline investigation to make sure about if the diagnosis is pre-eclamptic toxemia or not. Pre-eclamptic toxemia means high blood pressure with more or less edema or proteinuria. We are going to say about the pre-eclamptic toxemia, it is severe if the blood pressure is over 160 over 110. This means the fetus and the mother are at very high risk. I mean by very high risk that the mother may develop renal failure or hepatic failure or central nervous system disorder like seizures or stroke, which it may end by death. Can you imagine that? But we don't like to reach the stage to be a severe pre-eclamptic toxemia in modern medicine nowadays. Modern medicine, we are able to control the blood pressure by medicine which can help the baby at the same time. The other type of the hypertension, chronic hypertension with superimposed pre-eclamptic toxemia, already I have discussed that, starting by chronic hypertension, then after 20 weeks, there is a pre-eclamptic toxemia. The last one is essential hypertension, the fourth category. Fourth hypertension, which is called essential hypertension or transient hypertension. That is, we have to rule out all causes of hypertension to say essential hypertension to start the empirical treatment by the antihypertensive drugs. Situation like that, the treatment will be during pregnancy either regular tablet, which you can take it 3 times a day or 4 times a day, and under these circumstances, you will not be able to fast Ramadan. We are not going to put your life at risk, having renal failure or hepatic failure for the sake of fasting, because we have to control the blood pressure all the day through. And at the same time, the baby will be growing well with the skin patches. Skin patches, usually you change it every 24 hours, and it's not taken by mouth. It is a skin patches which is stick in your abdomen, and under these circumstances, if your blood pressure is well controlled by this fantastic and very good drugs for you and for the baby, I think you can fast Ramadan with the skin patches. At the same time, can we prevent increasing blood pressure during pregnancy, especially my previous history that I had pre-eclamptic toxemia before? Yes, see your doctor, he will give you advice. More likely, if it is mild degree or moderate degree of hypertension, you may be able to fast Ramadan with the long-acting treatment, which is taking every 24 hours. But in case of from moderate to severe, maybe we will not be able to treat you by single dose, and you have to go 6-hourly drugs, and under these circumstances, I don't think you will be able to fast Ramadan. Thank you.